Hi, I'm Dr. Stacy Elliott. I am a sexual medicine physician, and I've been doing work with men who have difficulties with their sexual function for over 20 years. Today we're going to look at how to do an intracavernosal or a penile injection. We use these injections when other methods, such as medications that you take orally, like pills or vacuum devices, or other ways of enhancing the erection are not working for you. So we'll go through the technique today in a step-by-step process. Many men use the injection technique because it is quite reliable. It does give an erection even if you've had nerve damage to the penis. And this is why it is so successful in some men who have had either surgery on their bladder, their prostate, or have had some form of spinal cord injury. The penile injections have advantages and disadvantages. The advantages of using penile injection include that it is a fairly reliable and strong medication that will give you a firm erection. You should get an erection within about 5 to 10 minutes that lasts a half an hour to an hour. The disadvantage is that sometimes penile injections can cause a little bit of scarring within the penile tissue and cause penile curvature. The most important thing to remember about injections is that if you inject too much, you could have a prolonged erection where you need to attend to the emergency to reverse that erection. And we will discuss ways to avoid that. Now we're going to review the technique for intracavernosal injection. This here is a model of the penis. And we are going to demonstrate on this model how to inject the penile shaft correctly to avoid bruising and to get it into the right area. When you want to do a penile injection, there's a few critical things. The first is that the lighting has to be very good so that you can see well. The second thing is you need to relax because this is the easy part. You're drawing up, the injection is very brief, and the hardest injection is the first, and after that, it's really not difficult at all. Matter of fact, most men said they don't even feel it. The next most important thing is to be sure that you set up your table or your bathroom counter or wherever it's convenient in a place where you can see well and that it's clean. You take your injection medication out of the bottle. The first thing you do is take a clean alcohol wipe and wipe off the top of the bottle. Because you're using this vial over and over again, it's important to keep it sterile. The next thing you do is take a brand new needle. And needles are a little bit sticky when you first open them. So it's helpful to take the handle and go back and forth a few times before taking the lid off. Do not touch the end of this. If it happens to hit your finger or clothing or the counter, you need to start again with a fresh needle. So the first thing we're going to do is draw back air to the level that volume that you're going to require. So if you need 0.2 cc's, you need to draw back the air to 0.2 cc's or even a little bit more. Then, because the needle is so fine, we put it in exactly through the rubber stopper at 90 degrees, otherwise you'll bend the needle. Then we flip this up, we push the air in, and we draw back to the amount that you need, or even a little bit more. And sometimes you'll see a small bubble. If that's the case, you pull the needle out, you hit the syringe like they do on the TV shows, but don't squirt it out because you're wasting it. But this will make the little bubble go to the top of the needle, and then we place this in at 90 degrees and we push that bubble out until we get exactly what we want. Again, pull this out slowly and gently place the cap on. Don't touch anything. Gently place the cap on so that when you pick it up to inject, the cap will fall off. Gently place the cap on and put it down on your clean surface. Then you're ready to try the injection. Now that we've drawn up the medication and we've carefully placed the top so that we can pick the needle up with one hand, we're going to look at how we're going to make sure that we get the right spot in the penis to inject. if you look at this model, you can see that there's two tubes. This is the flaccid state and this is the erect state. And we need to get the injection within one of these tubes. So that means that these two tubes are your point of contact, not the end of the penis, not the base of the penis, and not underneath the penis where the urethra runs. Within the little booklet, we talked about having an injection hand and a holding hand. I'm right-handed, so this will be my injection hand. First thing we do is we take the penis, we look and we make sure that the urethra, which is a small slit where the urine comes out, is directly up and down. When you pull the penis, if you twist the penis, then the urethra will also move. So we want to look up and be sure that it's direct. Then we take the injection hand and we roll back any foreskin so that we hold the glands of the penis, the tip of the penis, and we pull the penis straight out. Again, checking to make sure that it's not rotated. Then we use our holding hand and we come in and we compress down like you're pinching the whole penis so that the cavernosal tube, or the tube here, bulges out. And that's really important. If you don't hold it well, then the penis feels soft. But if you have a correct holding position, this will feel firm. Once you have a good grip, you look for vessels to make sure that there isn't a vein that you could pierce which will cause a bruise. Then we take the alcohol swab, we wipe the area clean so that it's sterile. We take your needle that you've already preloaded and you touch and insert all the way, push in the medication and remove. And you hold that spot for at least a minute. And if you're on anticoagulants, it will be 2 to 3 minutes. Once you've done that, if there's any bleeding from the site, don't worry, just compress and hold for at least a minute. And then you can let go and wait for the erection to occur. The most important thing, if your erection does not go away after about 2 hours, is to do active things to try to reduce it. The first thing you should do, if at all possible, is ejaculate. Or go for a walk, or if you're in a wheelchair, wheel around so that you get blood going to your lower limbs with an ice pack to try to reduce the blood flow into the penis. If that's not working, then it's very important to try either Sudafed, which is a drug that will switch your nervous system to try to make the erection go away, as long as your blood pressure isn't too high. If you still have an erection that is firm and rigid or even painful after 2 or 3 hours, it's very important to go to emergency. If the erection is softening but coming back, softening, coming back, it will probably dissipate on its own. But any erection that is not going down after 2 hours, you should make your way to emergency. There, the doctor will either withdraw some blood or inject something into the penis that will reverse the erection. It is not healthy to have a prolonged erection, even if you think it is. This is Dr. Stacy Elliott, and I hope that we've shown you how to use the intracavernosal injection technique. Remember that sex should be pleasurable and fun, and that all the things that you do to create an erection, if you can work them into foreplay or showering or something, would be really beneficial. Be sure to talk to your partner, and most of the time, partners are very understanding and very considerate of what you're going through. So, good luck.